the main issue continues to be how many doses will we have and when. Both the feds and the province want to say things are looking up, but there are still adjustments that have to be made, especially now that a whole new demographic has been added to phase 1 of the vaccine rollout. Count them, an additional 10, 20, 30,000 more COVID vaccine doses each week slowly rolling into Ontario. Not enough for mass inoculation, and yet officials still want people to feel like we're getting there, including Premier Doug Ford once again looking to the Prime Minister for reassurance.
Root cause, we need more vaccines. More vaccines will solve massive issues, and if he can deliver the 14 million, or at least our share, the 5.6 million, we are going to be in so much better shape.
Next week, more than 100,000 doses of the Pfizer vaccine will be available, now based on getting 6 doses per vial being shipped, as well as 47,000 doses from Moderna. So far, just 217,000 people in the province have been vaccinated, including 44,000 long-term care residents, along with those in other priority groups like caregivers, healthcare workers, and Indigenous adults. Now, plans to add another group to phase 1 of the rollout, with adults aged 80 and older being bumped up. Where they will end up in the queue, though, is still questionable.
We've got some of them done. That still leaves, though, just over 500,000 80-year-old and above in Ontario that we want to be able to offer the vaccination program to. So we want to get started early. If we should get more than 100,000 done in March, that would be absolutely incredible.
Other age groups will continue to wait, along with essential frontline workers. When asked about those in their 30s, 40s, and 50s as part of the general population, General Rick Hillier didn't want to commit to a time frame.
Well into summer. Well into summer.
The City of Toronto, meanwhile, continues to prepare with 4 of its 9 planned vaccination sites now set up at the Metro Toronto Convention Centre, the Toronto Congress Centre, Malvern Community Recreation Centre, and the hangar at Downsview Park.
The staff will be ready, the clinics will be ready, Toronto will be ready as soon as the supply is available. The training process is underway, and so it is now just the case that we need to get on to the schedule.
All public health units across the province are expected to set up at least 1 mass immunization clinic in its area. Now, phase 1 will continue through March, when a transitional period will begin into phase 2. What was expected to be 5 million doses per month after that has now been reduced to half that amount in April, May, and June.